day, everyone, and welcome to yet another episode of Outburst with Ohis. It is the eighth installment, and when I started this job 2 months ago, I didn't envisage this unquantifiable amount of support, encouragement, and love. So I quite appreciate. Today is a very special day. We have a very important guest on Outburst with Ohis today, a distinguished medical practitioner, someone who has established herself in the medical profession, Dr. Mrs. Imesidayo, Omua, Eboreime-Oikeh. Good afternoon, ma'am.
Good afternoon.
We're here to pick your brain, so to speak, on COVID-19. COVID-19 has been on the front burner for the better part of 2 years, and since it started last year, since we started experiencing it and it became a pandemic, people have had their say, different opinions, their government involvement, interference, and all of that. So we have always been meaning to talk to someone who has a great deal of experience in medicine and who can give us an expert opinion and analysis of COVID-19. So basically, what's COVID-19 and what has been the cause and the effect over the last 1.5 years or so?
First place will please for aligning to have our opinion on the topic COVID-19. COVID-19 is a pandemic, as we know. That the COVID is an acronym for coronavirus disease. In 2019, it was first detected and is reported to the World Health Organization in December, I think it will be on the 31st of December 2019. That's where it got its name from, COVID-19. And it's caused by one of the coronaviruses. In fact, the name of the microbe that causes it is called novel coronavirus, NCOV. But now we know it as SARS-CoV-2. SARS for severe acute respiratory syndrome because of what it causes in the lungs, because it's severe pneumonia in a severe form, right? So severe and causes respiratory distress. Respiratory distress is severe breathing difficulty. So SARS-CoV-2 and the CoV, of course, represents or stands for coronavirus. And then 2, because there's another coronavirus, I think this will be much earlier, 2003, about, arising again from China. So that was they're very similar. So this one and the previous one of about 2 decades ago are very similar in terms of sequencing of the virus, and they're both caused by coronavirus. Hence the name of this second type, which is called SARS-CoV-2. Right. Cause of SARS, we've mentioned, then the effects. As we said, it was declared as a global pandemic in 2020, that was March 11, by the World Health Organization. And it has spread through more than 190 countries and territories in the world globally. And so it has affected both young and old, those males and females, I'm sure, so no respect of gender. And though it's actually more common, it's certainly much more common among the elderly, but even the children are falling ill with COVID-19. Those who have comorbidities, other coexistent diseases, particularly obesity, diabetes, hypertension, bronchial asthma, heart diseases, cancers, and immunosuppressive conditions, other immunosuppressive conditions like HIV infection, acquired immunodeficiency syndrome, are coming down with this disease. But I can tell you that even those who were apparently well are also affected by this disease. It's a disease that has caused unimaginable problems in the world. So you can now name it. Lots of people, particularly during the lockdown of 2020, and I know that some countries are still under some form of lockdown. It paralyzed economic activity, to tell you the truth. And in fact, even protection against other diseases was at risk because people were no longer going to hospital. Public health officials could no longer reach the people they were supposed to reach, like children. They were no longer vaccinating children. Parents were not bringing their children to hospital because they were afraid quite not to get to be infected with COVID, where in fact most of the hospital beds have to be devoted to the management of patients with COVID-19. People, because they were ill, of course, were then less productive as they would normally be. And I do know that in Edo State, at least in the main city, even markets, there was a time when it was possible to go to market on a daily basis. So yes, the impact both on the health of the population, on the economic activity, and even healthcare systems, those things have been negatively impacted by COVID. And in fact, even now with the various waves of this pandemic, of this disease, we are continually being impacted. The consequences on groups and individuals, it's immense, I can tell you that.
All right, thank you very much, Ma.
Yeah,
we actually thought that COVID-19 had been properly and professionally managed, maybe controlled to a great extent until there came the third wave, which was probably propelled by, or maybe by the Delta variant, whether it came before it or it came with it, or it was the Delta variant that prompted the WHO to term this new the COVID-19, the third wave. It is something that we want you to clearly air on. What exactly is the Delta variant, and how come it is probably deadlier than the COVID-19 that has been experienced since 2020?
There have been a number of variants. I think the WHO prefers to refer to them as variants of concern. And the most worrisome, as of today, would be the Delta variant. The Delta variant is a mutation of the original SARS-CoV-2. And there are actually a lot of it. There have been a lot of variants since the first sequencing of that virus, the SARS-CoV-2. There's been the Alpha variant, the Beta variant, the Epsilon. In fact, currently, even after the Delta, we have the Mu variant and the Lambda variant. But by far the most highly transmissible, in other words, the transmission, the spread of the Delta variant is actually much more than the other variants that we know. I think the first variant was first associated with India, and I know that the Indians do not like it very much for it to true. But in the United States of America now, more than 90%, if I'm not wrong, and I'm sure I'm not because it's the public domain, more than 90% of the infections currently in the United States of America are attributable to this Delta variant. So in fact, the Delta variant is even now affecting children. There was relative protection of children against this SARS-CoV-2. In other words, they were less likely than other age groups to be infected by SARS-CoV-2. But with the high transmissibility of this Delta variant and the more serious infection and the faster rate, in other words, once the exposure, after exposure to the Delta variant, individuals are more likely to come down with the virus, with the infection, with the viral infection. So the incubation period of the Delta variant is actually less. And it's not actually as susceptible to protection by the vaccine, the usual vaccine that we have, this mRNA vaccine and the other types of vaccines. So it's quite problematic. And yes, the third wave, and I'm in fact sure probably even the fourth wave in some areas in the world, the third wave is likely to be due to the Delta variant. I said this because it's more severe infections, it's more highly transmissible, and it causes infection faster than the other variants, and in fact the original SARS, as we know it. So I think it's right to say yes, the Delta variant is likely to be responsible for the current third wave of.
All right, thank you. You talked about vaccines when you were clearly explaining the Delta variant and wonderfully analyzing it. The vaccination has caused a lot of different opinions, people being on different sides of the divide. Some people are pro-vaccination, others are anti-vaccination, especially in those states, of course, where the government has taken the lead on ensuring that people get inoculated. But vaccination in its entirety, what are the pros and cons? Because as a medical practitioner of repute, you definitely will be pro-vaccination, of course. But I want to know from your perspective, your point of view, what vaccination is and how you think people who are anti-vaccination can be sensitized or educated enough to see the need to get vaccinated.
Both sides of the divide have their arguments, all right, and they're plausible. However, we know that vaccines in general are meant to protect against the infection. And in the case of COVID, I must say that even those who have been vaccinated still can come down with the infection. But I think from studies worldwide, we can found that those who have received vaccination, and there are a variety of vaccinations at the moment in the world globally. In Nigeria, they start with the AstraZeneca, and currently I think there's the Moderna from the United States of America. I don't know if Pfizer is available. I know there will be a type, but I think the majority of them have now the AstraZeneca, then Moderna, and possibly the Pfizer. The Pfizer that got full authorization, and I think it's now called Comirnaty vaccine. So as I said, those who vaccines are like any other type of chemical. Though they are mainly protective, they also have side effects. In fact, there is absolutely no drug or vaccine that does not have side effects. It's just to weigh to the balance of the benefit and the harm associated with whatever it is you are administering. There have been reports worldwide, both I just mentioned that at the moment they are not vaccinating children below the age of 12. In Nigeria, I think it's just adults above the age of 18 that are currently receiving the vaccination. So in terms of the vaccination, there have been a few side effects that have been mentioned, and there's evidence that yes, some of these side effects are associated with the vaccination of the COVID-19 vaccine. So some of them are the usual, like fever, some malaria, fatigue. People down with clotting problems. And clotting can affect the peripheral areas like deep venous thrombosis. A few of them have had clotting in the lungs that refer to that pulmonary embolism. And of course, very few, some fractions would have had stroke, and some might come out with a heart attack. I hear that in fact, even in younger males, there's a possibility of them having inflammation of the heart. Now, I'm mentioning these very serious, well, some of these side effects and some of the very serious ones to say that those who do not want to be vaccinated must have this. And we must, exactly, not necessarily justified, but yes, we must look at them and know that they're rational beings and not to discriminate against them or just throw off their fears outright. However, these side effects from a very small fraction of the population of people who have received the vaccine. I must say, received both doses of AstraZeneca vaccine, and I do not remember having any side effects. I was looking forward to having side effects, and I thought that I might come down with, considering my age, because in fact, age is actually another factor that can make you susceptible to side effects. And in fact, also, one is at risk too for the infection itself, not even the vaccine. So we're more likely, we're more likely to come down with the infection because of our age. However, I took the two vaccines, the first and the second, and I can say boldly that I did not have side effects. I did not experience any side effects. But that's not to say that other people would not or did not have side effects at the time they received theirs, or in fact that those who are actually going to get the vaccine will not have side effects. The majority of the side effects, if any, are very mild. And I think the protection that the vaccine or the vaccines offer against the disease is actually much more beneficial than what not receiving the vaccine. And I can tell you that if you have seen, and I have seen a couple of patients who've had COVID-19, really frightening. And maybe those who have not had the vaccine can get themselves properly protected and go to visit some of these hospitals, with the proper done all the personal protective equipment, and just have a look at one or more of those people who actually have COVID-19. That, I think, will convince them to actually go and get the vaccine. So my take would be that the vaccines are available in Nigeria, and yes, there are side effects. A lot of them, majority of them, a high proportion of them, very mild side effects. Maybe some of them might have more severe consequences of the vaccination. I'm not aware that any deaths have been recorded in Nigeria following vaccination against COVID-19. There have been a few reports outside of this country. There are few too. So please, those who need to be vaccinated, I'd encourage everyone to take the vaccine. As I said, I think in Nigeria now is for adults older than 18 years of age. You have the opportunity and opportunities abound. Please take the vaccine. The vaccines are free, as far as I know. They're free, they are readily available. So please take the vaccine. The effects of the disease, particularly the severe COVID-19, is far, far worse than any side effect that you can possibly have, at least in Nigeria currently, with the vaccine, the COVID-19 vaccine that are currently available.
All right, thank you very much. I always wanted to ask this question. What inspired you to be a medical doctor? Or at what point in your life did you know for certain that you're going to be a medical doctor?
Now, I can't immediately pinpoint the time when I actually decided I would like to be a medical doctor. But I know that most children, I don't know what it is like now, but I think in my time, most children would want to be medical doctors. And most parents too would like their children to be medical doctors. I do not remember actually deciding to become a medical doctor, to tell you the truth. I know that every person just assumed that I'll be a medical doctor at one point or the other in my life. But in my secondary school, I remember my history teacher telling me that even though he knows or he's sure that I'll become a medical doctor, because a lot of people have been, tell me that to my face, but that he would prefer that I do economics. That he thinks that I don't know, my future prospects will be better in that field. But as I said, every person, and possibly at some time, maybe later in life, I thought that yes, I might want to be a medical doctor. But I do not cannot recall a particular time in my life when I said definitely I would like to become a medical doctor. I do not like blood. I've never liked blood. Even as a medical doctor, I've never liked the exposure to blood or anything, and I know how difficult it was for me, or dead bodies in the first place. So I remember when we were doing anatomy, I actually had to hide behind some of my colleagues when we were doing the dissection. But the practice now, I'm very much involved in practice of medicine, and I'm really glad that God allowed me to become a medical doctor. I'm very pleased, and I thank God for His grace.
Well, because the health sector in Nigeria is in Florida State, what do you think the Nigerian government can do better in terms of health? We see most of the time the Association of Resident Doctors go on strike, they call on strike, they go on strike again. There must be something different. There must be a different approach entirely to all of these problems. Strike actions, people feeling hard done by, people feeling maybe demotivated, they can't go to work, or they don't have the confidence to go to work because they don't get paid. As I mentioned, some don't even get paid at all. So what do you think can be done a lot better in terms of health in our dear country, Nigeria?
Let me just say to something that I do not know whether I'm in a position to recommend.
Well, you are. You have been a medical doctor for at least 30 years.
Yeah, but I don't think I have the authority.
Just your suggestion
for policy changes or things like that.
Yeah.
But I don't think one needs to be a medical doctor to see that there are lots of things that need to be done in this country called Nigeria. Not just in the health sector, in every aspect of life in Nigeria. The first thing I would say is that if it's possible to prevent should we say those in power, these public officials from accessing healthcare outside of this country, I think that would be a good first step. But it's only when they feel the impact of the very poor healthcare system that we have that they would think about how to enhance the healthcare system that we have in this country. So first, no one should go abroad except under very extenuating circumstances, but particularly those at the top of the hierarchy here in Nigeria. And that would, of course, start with the President of the Federal Republic of Nigeria. That would be the first thing. The second thing is we should make facilities and villages and they get their acts together. The medical doctors have very good training, I must say, in this country, comparable to any elsewhere in the world. It's true that we don't have a lot of facilities to train with, but at least the theoretical knowledge and the skills that we have, in fact, enable medical doctors here to get employment in any other part of the world, including the US and Europe and the United Kingdom, where I think the healthcare services there are quite good. So it's the training can improve. There's a lot of room for training for medical doctors. And therefore they should be motivated and encouraged with not just good facilities, but good remuneration. So in fact, we have to be well paid. I'm talking about medical doctors because I'm a medical doctor, but this should cut across the board. All healthcare professionals and everyone working, not necessarily professional, non-professional, I must say. In fact, even the support staff should be encouraged, because I know that we're losing lots of these people to other countries, particularly the United Kingdom. So we must get our act in place, get proper, and we can do that. is an oil-rich country. I don't know if we're still the largest economy in the world. Sorry, in Africa, but we're certainly up there when it gets to other African countries. And I have had the opportunity of practicing in other African countries as well as in the Western world. And I know that the facilities in Nigeria belong to desire to tell the truth. So we need facilities. And yes, they can be provided. After all, we have some private medical facilities that have cutting edge technology and facilities. So if private individuals and groups are able to provide it, why not the federal government of Nigeria? So let's provide the facilities, train the doctors properly, encourage and motivate healthcare providers, professionals and non-professionals, and then give us an enabling environment to provide the best services that we possibly can, and ensure that those in authority actually access healthcare here in Nigeria. These are all points help a great deal in ensuring and enhancing our healthcare delivery system in this country of Nigeria.
All right. Thank you very, very much for your time. You know that you have a very busy schedule, and congratulations on 1 year of the Lead Health, your brainchild. Thank you very much, Ma, and God's mighty blessings.
Thank you very much, sir. Thank you very much.
All right. Thanks a lot, guys. We will head from Dr. Mrs. Imesidayo, Omua, Eboreime-Oikeh. Thanks for watching, and have a great day ahead.